tracing systems based on local public health teams, such as in Scotland, Wales, and now in some parts of England, have all outperformed the centralised SERCO system, which has barely reached 3/4 of cases and well under 2/3 of contacts. I welcome that local public health teams will now be directly involved in contact tracing in areas of high COVID spread. But will the Secretary of State now have them lead contact tracing in all areas across England to help get the test, trace and isolate system working effectively? And will he ensure that appropriate financial resources are moved to local authorities to fund this? Unfortunately, the hospitality industry is being hit particularly hard, both by the virus itself and the restrictions to control it. As we now know, COVID is spread by airborne particles as well as droplets, and it has become clear that ventilation is key to reducing viral spread indoors. So will the Secretary of State ask the Chancellor to promote the installation of filtered ventilation units by removing VAT and making them tax deductible? That way the government could help the hospitality industry make their premises more COVID secure, rather than having to repeatedly shut them down every time cases surge.
Secretary of State.
Thank you very much, Mr. Speaker. Well, the Honourable Lady talks about the testing system, and indeed the UK-wide testing system is an example of this whole country working together to keep people safe. The UK system provides the majority of tests into Scotland and works very closely with the NHS in Scotland, who also, of course, provide important testing capacity. That is an example of the local system in Scotland and the UK system nationwide working together for the people of Scotland.